Dr. Zymantas, lots of people have dental phobia anyway. Hardly any one of us really likes to go to a dentist. So it's quite amazing that somebody like you loves being a dentist when most of your patients kind of wish they wouldn't have to be there. But, thanks God for us, you dentists do like what you do on an average. Anyway, there seems to be wonderful new technology to how to put a patient asleep, but not really put him asleep. So it's totally aware. It's all wonderful happening. And, obviously because of it, no pain. And it's called sedation dentistry or sleep dentistry, whatever you want to call it. Tell us about how that works. Are there any side effects? And what are some of the major benefits?
Primarily what it is there's several different types, primarily with the different kind of medications used. What I do is what's called conscious sedation, IV conscious sedation. And, it's really quite a beautiful drug that we use called Versed. And when we use this drug, the most beautiful part about it, well, there's two big aspects regarding it. One is that it sedates you, which means that you're kind of sleepy in a way. You're not really conscious. But if I talk to you, then you will respond to me. Your protective reflexes are still active. So it's from a physiological standpoint, it's not very abusive to the system. The other nice part about Versed is that there's an aspect to it called anterograde amnesia, where a little bit after the anesthetic starts taking effect, the patient will have no recollection of being in the chair or having had the procedure. In fact, most patients that have the procedure done, they wake up and their procedures are completed, and they're kind of looking around and saying, okay, when is the procedure going to start? And this could have been like 4 or 5 hour procedure, and the time just kind of dissolves away, and their fears dissolve away too. Who would be interested in having sedation? Well, there would be, say, people that are disabled and can't control their body very well. Oftentimes that will be a good reason for sedation. People that are phobic, just out and out afraid of coming to the office, those are the primary people we deal with when we use sedation. There's also people that have very strong gag reflexes, and if you can't have anything in your back of your mouth for an impression for a crown or placing implants or something, that's another great aspect for IV sedation. And then there are people who just don't want to be here. They want to be somewhere else. They want to kind of take a little vacation mentally and go away while the procedure's being done, and that's another big part of our practice. And in order to do IV sedation, it's a special training process I've gone through several universities, University of Illinois, Department of Oral Surgery. I was specially trained there. I was specially trained at the Medical College of Georgia Oral Surgery Department, and University of Puerto Rico through a implantology program also. So every step of the way kind of added some more benefits as far as being able to provide a safe situation for patients to be able to be put out. And as far as the safety, the medications are, if used properly and which we use them in a proper way, they're very, very safe. My staff is specially trained. We've just had another layer of special training that most offices don't even have yet, because in Illinois they're going to layer another layer of bureaucracy for us, but already we've had the training we need to comply with the guidelines of the government, more or less. But we're always in training and making sure that the procedure is going to be a safe procedure for the patient.
Right, so it is a safe procedure. There are no side effects, except they kind of like good side effect that you forget where you were. That sounds like being able to go on a drinking binge and don't have a hangover to me.
Similar.
Yeah, so that's a good thing, and also I think it's probably very good for patients who need or want and have an awful lots of work in their mouth, where if they have to come and get normal injections and do the work, there's no way you can keep them in a dental chair 4, 5, or 6 hours, where I think with this sedation dentistry you can keep them in for a long time and then get a tremendous amount, if not all, work done, even though it's a lot. Is that true?
This is correct. Just this week, we just had a woman who came in and she had a significant amount of difficulties. She was very phobic in coming to the chair. On one-on-one, you just interacting with her, you wouldn't quite think that. There are two kind of patients. Some that are, you can visually see that they are totally afraid. One patient, it sticks in my mind, where a grown gentleman, about 50 years old, he was able to get to the dental chair, but before I even was able to look in his mouth, he had to cower and crawl on the floor and cowered in the corner like a puppy dog. That's how phobic this man was. And then on the other hand, I had a woman just last week, and you wouldn't be able to tell that she was phobic, but she was extremely phobic. Talking to her, she seemed very calm, very at ease, but she didn't like the idea of having dental work done while being conscious. So it just works out great. It's a superb win-win situation for everybody.
Right. Well, thanks a lot for explaining it so well, Dr. Zymantas. Thanks a lot.
Thank you, Mr. Flash.